Exhausted and overworked. That's how many healthcare workers are feeling in the valley right now, as staffing shortages remain a major issue in the valley.
That's right. Anchor Abel Garcia spoke with some medical workers about their challenges and what to expect in the near future. Abel.
Trisha and Dave, I talked to a nurse who is telling me that at her facility, some of her colleagues are having to take up to 8 to 10 patients a day. She says right now they're not providing the proper care that they need to these patients, and they're close to reaching their breaking point, where some nursing students here at UNLV could be the potential solution to our problem.
Because we just don't have enough staff to work. So it's hard when you don't have enough, we can't provide care that's needed to the community.
A common situation for many healthcare workers throughout the valley. As a shortage of medical staff continues to go up, Catalina Guzman works at an urgent care facility, and she says medical workers are burnt out.
Very, very exhausted, very tired. I mean, we work, even during the surge, we were working so our normal schedules are 13-hour days, and then it gets turned into 15-hour days, and it's just very long, and you have to come back and do it all again the next day. Is very hard and difficult.
Towards the end of February, the Nevada Hospital Association said our medical staffing shortage is at a crisis level. Guzman says at her urgent care facility, she has seen some nurses with up to 10 patients at once.
That turns into like a patient safety issue. Each nurse should be able to totally care and give all their attention, and they can't take care of 5, 6, 7 patients at one time and be giving them the proper care that they need.
Nursing students at UNLV responding to the call for help.
Do have 20 plus nursing students now working as nurse apprentices.
BSN program director at UNLV, Dr. Angela Silvestri Elmore, says their apprentice program is showing a positive result. She says about 300 nursing students are expected to graduate this spring, and of those, about 90% are expected to work in local hospitals.
Whatever we can do from the perspective of nursing students, not only does it, I think, help us to help our community and help our patients, but it is also going to help us prepare nurses that are well prepared to be able to take care of really complex healthcare needs.
Nicole Taylor is a level 2 nursing student at UNLV, and she's a part of the apprentice program. She says the first day she walked into her hospital, she noticed a significant need for help.
You just always have to stay on your toes, and some of the nurses are not getting breaks. You just never know what to expect from your patient. So it's just very hard to see that, but also try and take it all in because you want to. That's why I actually just joined the team, is just to help as much as I can.
Taylor says she is seeing a large influx of patients that have delayed their health care as a result of the pandemic, making things harder for nurses, but she is glad to help.
All around, there's a shortage going on in the hospitals. And I think just seeing it for myself is just more eye-opening, because it's really crazy what is happening in our healthcare system right now. And the more help is, the better for these nurses to give the best care to the patients.
Now, Taylor also tells me that she is very ecstatic to be a part of this program, and she's hoping that many more students will also want to be a part of this apprentice program to not only get the hands-on experience that they need, but to also be able to help during the staffing shortage. And of course, in addition to that, the School of Medicine tomorrow will be having their match day. And this is a very big event here at UNLV because it basically allows those individuals who have been working to become a doctor to finally find out where their residency will be. And for many of those doctors, it will be right here in the Valley to help with the situation and to also provide many here in the community with the need that they deserve and also the care that they deserve. I'm Abel Garcia reporting live from the UNLV School of Medicine.